Hello, this FERNE presentation involves the treatment of emergency department patients with dizziness and vertigo with the intent to appropriately diagnose and treat patients with serious central etiologies for these symptoms. This video discusses Triggered Episodic Vestibular Syndrome, s-EVS. My name's Ed Sloan. I'm an emergency physician in Chicago. I serve as the FERNE president and board chair. I have no financial conflicts. For more information, please go to our ferne.org website or our YouTube channel. So the ATTEST system, part 3, involves whether or not the patient has episodic vertigo and whether or not it's spontaneous or triggered. In this case, we'll discuss triggered episodic vertigo. This comes from the monograph written by Dr. John Edlow. It's a great piece called The Timing and Triggers Approach to the Patient with Acute Dizziness, published in 2019. So we're now at the portion of the clinical pathway for the ATTEST approach to ED patients with acute dizziness and vertigo. And we ask the question, is the dizziness triggerable? And if the answer is yes, it can either be due to BPPV or orthostatic hypotension. So here where the star, it shows that the triggerable dizziness leads us to these two diagnoses. So triggered episodic vestibular syndrome. Is there a likely medical cause? No, it doesn't seem to be the case. But there might be a little bit of worrisome nystagmus. If that's the case, you ask, is the vertigo continuous and present at the time of evaluation? The answer is no. And then you ask, is it triggered with something such as head movement or standing? If the answer is yes, the diagnosis is triggered episodic vestibular syndrome, s-EVS. So this either is a peripheral cause such as BPPV, which is benign. It can also be due to orthostatic hypotension, which is systemic. In other words, triggered with standing up quickly from lying down in bed, for example. But it also can be due to a posterior fossa tumor, which is a central cause. So, in conclusion, when you determine that the vertigo is episodic and triggered, there are a few diagnoses to be considered: peripheral BPPV, orthostatic hypotension, or the rare case where there might be a posterior fossa tumor. If you have any questions or comments, please get a hold of us at ferne.org, at gmail.com. We look forward to hearing from you. Have a good day.